Welcome to this screencast where we'll be discussing the accessory structures to the eye. This can either go before or after the gross anatomy of the eyeball itself. So here we're going to talk about the external and accessory structures of the eye, as well as then the muscles that control eye movement. So first, here we have an eye, and this is a little overwhelming at first to take a look at, but it helps if you looked at the eye anatomy screencast first here. So this is a sagittal section through the eye and also the orbit. So this color stuff right here is the bone. Right? So this is the frontal bone, and then this is your maxillary bone below. So this is all the vitreous humor of the eye. Here's the lens. Here's the aqueous humor. Here is the iris, the suspensory ligaments, the ciliary body. Right? This is then the cornea. Right here is the cornea, and then this white space right here is the space where a contact lens would go. If you wear contact lenses, then this is where you're putting it. So then this thickness right here is the eyelid. This is the upper eyelid, and then here would be the lower eyelid. Here's an eyelash coming out of there. Here's an eyelash coming out of the lower lid. These are your eyebrows up here. And we see this upper lid here has a thickness to it. There is a little bit of muscle in here where the red is. The yellow is a little bit of fat. And then this structure right here is the tarsal gland, and this is an oil gland that's going to secrete oils to keep your eyelashes nice and supple and not brittle and breaking off there. These eyelashes, of course, are protecting the eye from any dust particles that might get in there as well. So this inner part of the eyelid right here is called the conjunctiva, and it will then become continuous. It folds over here and then becomes continuous with the cornea and the sclera. So again, here's the sclera of the eye, here's the cornea, and that conjunctiva is that inner inner lining of the eyelid. So there is fluid that's secreted by this conjunctiva here, and it could become inflamed, and you get a situation known as conjunctivitis. Conjunctivitis. Right? And this is an inflammation of the conjuncta, or the conjunctive membrane, and severe cases of this lead to something called pink eye. Right? So you get a bacterial infection in there, which can be resolved with antibiotics most typically. Right? So there are some of the accessory structures. You have these glands here, and the conjunctiva, as well as the eyelashes. Right? Moving to a more anterior view of the eye, you have a gland called the lacrimal gland that sits superior and lateral to the eye. Right? So here's the lacrimal gland up here, superior and lateral to the eye. And this lacrimal gland is an exocrine gland. It's exocrine, and it secretes tears. So as these tears, since it's an exocrine gland, the secretions go into a duct which is open to the outside world. And then the tears move across the surface of the cornea, right, and will drain out of two little holes, superior and the inferior lid, called the puncta. And if you turn to the person sitting next to you, or if you look in a mirror, you can kind of pull your eyelid down here, and you can see those little holes right there. It's difficult to see the superior one, but you can see the inferior one relatively easily. Right? And so as those tears move across the eye, they then go into these puncta, which are openings to little ducts. Right? The ducts are the Lacrimal Canaliculi. Right? Look at the word here, canal, and liculi is a small canal. And so these are small little canals that then drain into the lacrimal sac, right, which is inside of your nose, right? And then that will open up into the nasolacrimal duct right here, and the tears then are usually, they will evaporate by the time they get down into here. But if you're crying, you have nervous system stimulation of this exocrine gland, and you produce a lot of tears here. If you get something irritating the cornea, you also produce tears, and those tears will then flush that, that debris out. If there's so many tears being produced that these puncta get all loaded up and the lacrimal sac gets all loaded up, then the tears begin to spill out over the lids, right? And then you have, right, tears crying down, dropping. Oh, so sad. So many tears crying down. Okay? But this also explains why you get kind of like stuffy as well. You get all nasally congested there because the tears are going into this lacrimal sac. And you may even drain it out your nose there. All right. Moving on to the muscles that move the eye. There are 6 muscles that move the eye, and they are named for the location of them. First off, here they are down here. 1, 2, 3, 4, 5, 6. This rectus. Rectus means straight and refers to the direction that the fibers are going. So if you look at the cartoons of the muscles, if you look at this one over here, you see the fibers are all in a straight parallel line with one another. So that's why these are called the rectus muscles. And then the first name of the muscles, lateral rectus, well, this is the one that's on the lateral side of the eye. The medial one is on the medial side of the eye. The superior one is on the top of the eye. The inferior one is on the bottom of the eye. And then you have these inferior and superior obliques. Oblique means at an angle. At an angle. Okay. So these muscles, they'll be straight, but the fibers will be going straight, but the muscle is going to attach at an oblique angle. Right? So if you think of like the compass here, right? So north, south, east, west, right? Lateral would be either east or west. Medial would be either east or west. Superior, north-south. Inferior, north-south. So the inferior oblique, since it's coming at an angle from below, would be like either southwest or southeast. And then the superior oblique would be either, you know, from the northwest or from the northeast, depending on the eye. So the directions of these things, muscles, are relatively self-explanatory. So if you look at this image here, this is a lateral view of the eye. So this would be the lateral rectus. This would be the superior rectus. This would be the inferior rectus. The medial rectus is on the other side of the eye. Right, so theirs would be the medial rectus. And then this is the one that's coming at an angle. So this would be inferior rectus. And then the superior rectus comes up here and comes at this angle through this, this trochlea. Right? This is like a little stirrup, right, to sort of guide that muscle, that superior rectus, superior oblique muscle, right? So I would recommend going and looking at both of these links, and I put them on Blackboard in a separate folder there. So take a look at those. Interesting about how the eye muscles are working. Okay. And then I give you some blanks to practice labeling. So there we go.